Implant failure after a spine surgery. What do we mean by this? When we talk about implant failure, that means the screw or rod which was put during the primary surgery or the first surgery of the spine has failed. Normally these screws are made up of titanium and they are very strong. But of course in rare cases there might be implant failure in a way of screw breakage or rod breakage or even the cage moving away from its normal position. So if you had undergone a spine fixation surgery for say spinal fracture or instability or tumor, and in the new X-ray or new MRI you find that your screw or rod it is broken or there is a misplacement of the screw and rod from its original position, then don't worry. You need to get your CT scan, MRI and X-ray done, and based on your CT and MRI we will do a study of what has actually gone wrong and the reason behind it. Normally if we are planning for a revision spine surgery after an implant failure, we normally put bigger and stronger screws or screws in new track, or we even change the choice of implant, like sometimes we put anterior implant, that is the implant from the front, if at all the surgery from the back has failed. So if there is implant failure and you feel pain in the back or there is a nerve root irritation because of the implant failure, don't worry. Normally CT scan and MRI after the surgery or before the second surgery gives us adequate information about why the implant has failed. Now what we do in an implant failure case is, whenever we are operating for a second time, we to increase the safety of the patient, we use 3D navigation technology and we study each and every nerve and the bony architecture around the nerve to make the surgery successful. This 3D navigation technology or the use of O-arm or nerve monitoring during the surgery gives us high accuracy even in planning these revision surgeries where the primary surgery has failed and the implant is broken. However, in most of the cases, whenever there is an implant failure, there is of course a chance that bony fusion or union has not occurred. If there is a failure of bony union or fusion, then we put products like bone morphogenic protein, or we put more bone graft to make it a union, and so that the surgery becomes successful. So if you have implant failure in your first surgery, don't worry. Forward your X-ray and MRI to us on the number shown, and whatever is the best possible solution for you, we will try to provide you with the answer. अगर आपको हमारा ये वीडियो पसंद आया तो हमारे चैनल को सब्सक्राइब करना ना भूलें और ज़्यादा से ज़्यादा शेयर करें।